another episode of On the Mic with Ed. You are here with myself, Maria Ortiz, and co host Dr. Zoe Ross-Nash. We also have Jennifer Nourse here with us today. And today's a really cool episode. We are going to be talking about a hot topic in many fields today that is GLP-1s. So we are super excited about this. We're very excited for Jennifer's expertise here as a mental health professional. And we hope that this can just be informative for everyone. And we just feel like we needed to talk about this in the community today. So I'll let Zoe thank our advertisers and we'll get going.
Yes, a special thank you to our advertisers, Alsana. Alsana has both physical locations in Alabama and California, and then virtual IOP. They also have an IOP specialized for teenagers, which is really, really cool as well. And before we dive in, I do want to give a caveat to this episode that all of us here are mental health professionals, and we're going to be talking about GLP-1s today. So this will just be anecdotal experiences that we've either noticed in ourselves or our clients or stories that we've heard from friends. And a little bit more about GLP-1s. According to SunCloud Health, Ozempic is an injectable medication primarily used to help adults with type 2 diabetes, a way to manage their blood sugar. It is not marketed as a weight loss drug, but it is part of the group of GLP-1s typically. We see other sorts of GLP-1s like Ozempic or Wegovy. And what's another one? I'm trying to think.
Saxenda?
Xenda, so there are a lot of names for these different types of medications in this class. So definitely become informed on those different names. If a provider does make these recommendations to you, you can feel informed about it. So while they are not marketed for for weight loss, they are FDA approved for managing weight. And these medications might have significant risk for people with eating disorder histories, and they can really worsen symptoms of malnourishment and affect mental health negatively. So really check in with your psychological effects, because GLP-1s can have a lot of increased risks regarding mental health. We see bone loss, hair loss, bowel obstruction, and that can really negatively impact your physical health and your emotional health.
And Jennifer Nurse, would you like to share a little bit about yourself? What brought you on this pod today? A little bit about the work that you do?
Yeah, absolutely. Absolutely. So I guess what brought me here today was I've been following you guys for some while and really enjoy listening to your podcast. And I think as someone with lived experience that's gone through an eating disorder as a adolescent, and then also with a relapse in midlife in conjunction with the GLP-1, I felt it needs to be shared. It needs to be talked about. It's real. And the GLP-1s are a hot topic, as you were saying. Like they're a hot topic right now. And you can pretty much go on any social media platform and see ads for them. Um, I also am a mental health professional and I work face to face with clients. And I don't work in eating disorders directly, but I do. I have seen patients, clients in the past who have suffered from eating disorders, and I have a genuine, I guess, inclination and passion about helping women in middle age.
Thank you so much for being here and sharing your story. When you reached out, we
Yeah.
were so excited to have a voice like yours. And I feel like especially with this um, older adult women or that 40 plus age group, they're not talking about eating disorders as much. So your voice is so
Yeah.
needed. Um, I guess even going off of that, can you share how your relationship with your body has changed over the years?
Yeah, absolutely. So growing up, I was a ballet dancer from a very young age, and was often no one ever really talked about my body when I was in a ballet dancer, but I was keenly aware that I was larger than other girls, and very internally aware of that, and maybe somewhat bothered. But I knew I was strong and I was healthy. I also played a lot of sports going into middle school and high school. Um, I was a big soccer player, and the, interestingly, a pivotal moment for me with my relationship with my body was my high school guidance counselor had said to me, "You have really big thighs," and I was like, "Oh." Oh, and that was a pivotal moment. Like, I mean, it's stuck with me since I was 16 years old. And really, those big thighs were muscular thighs. They were very muscular. Um, Moving into my early 20s and 30s, I was a personal trainer. So very fit, very strong after having gone through anorexia as a teen. Kind of bounced my way through that. And, then became this a personal trainer, very fit, very healthy. And then, so I had a good relationship with my body through that time. And then life circumstances changed, and I went back into working in mental health and back to a desk job and less focus on my well being, my physical well being. So my body took a back seat, and I didn't have a great relationship with my body, which kind of landed me back into more of a overweight category and having some health issues. So really, again, struggling with body image. So there's definitely been a roller coaster with the relationship.
What an eloquent explanation of just how the relationship with the body can change through different years and time periods.
Yeah.
We are just, yeah, very grateful for your voice and your honesty and vulnerability with this stuff. What stood out to me there was that one comment shaped a lot of this for you. And I hope that's something that people hear, that one comment can just, it can really do a number on a psyche that might have some sort of predisposition, something clicks. Um, and yeah, you said, "No, my thighs were muscular." And I'm sitting here even like, even if they weren't muscular, they're just thighs. Like, I don't know. So I hate that that was a body comment that you received. But I'm interested. So Zoe shared a little bit about GLP-1s. I'm interested to
Mhm.
hear from your perspective, kind of how you describe the GLP-1 as you were prescribed one, and what was the reason that it was prescribed for you?
Yeah. So GLP-1 medication, as I learned from my doctor, actually mimics a hormone that's naturally produced in our body, right? To help with appetite regulation. I think also in terms of insulin, blood sugar regulation. I was prescribed a GLP-1 because I had reached a point in my life where, and I really don't like BMI, but by BMI standards, I was considered obese. And I was having metabolic dysfunction. I had non-alcoholic fatty liver disease and insulin resistance. So I was put in touch with a obesity medicine specialist um, who prescribed a GLP-1 for me to help with weight loss and getting insulin resistance back on track again.
So when
Yeah.
you were prescribed, did anyone ask you about your history with eating disorders?
So when I arrived at my doctor's clinic, we talked a lot about, yeah, we talked about my health history. I believe I mentioned, but I kind of fluffed it off that I had had anorexia as a teenager and that I was very ill and that I had bounced through bulimia. And when I arrived at her clinic, she had diagnosed me with binge eating disorder. So, yes, it was acknowledged. Um, and it was also, I guess, 30 years prior that I had gone through an eating disorder. So, for whatever reason, we decided to forge forward with the GLP-1.
Gosh, what stands out to me is even though it was 30 years prior, were you given any resources for support in case of a relapse, just if it was in your history?
Um, no, I wasn't. And in fairness, and I was one of her first patients in her practice, and this stuff was all new. Like these GLP-1s, screening for past histories of eating disorders wasn't something I believe was being done. And if it was being done, it wasn't done with a lot of thoroughness. And realizing, I don't think doctors realize the implications the GLP-1 medications could have on someone whose eating disorder may or not may or may not have been resolved.
I want
Yeah.
to give some credit here to this topic is just so new. So there's just an astounding lack of research. I'm not surprised at all to hear that they forged forward, even hearing the history, because I have seen people actually get prescribed GLP-1s with active eating disorders.
Yeah.
And
Oh,
so,
wow.
and I think one of the main issues that I see here is that there's just no research on if you had a history or current eating disorder, what is this GLP-1 going to do for your body? And I think a lot of this is just the research is being created right now. Um, but it's disheartening to hear that you weren't at least provided resources. And to me, that shows a lack of awareness and understanding of risks associated with a history of an eating disorder and what could be a potential risk factor or trigger for relapse. To me, it shows just that lack of understanding. I am curious, though, outside of, any of the weight or physiological changes, how are your thoughts and emotions impacted once you started taking this medication?
It's an interesting question because my thoughts and emotions were almost instantly triggered. I would say within 2 weeks of starting the medication, I started having um, less food noise, the ability to go for longer periods without eating, not feeling fatigued. It was almost like a bit of a high being on this medication because for the first time, I felt this medication provided me the ability to carry on in my career, to eat less, to lose weight, and not have food noise or brain fog or tiredness. It was like this, like my I call my ED Ed. Ed grabbed that. He grabbed the GLP-1, and yeah, I think what I can say is I finally had freedom from food obsession and the noise when I started taking that medication for the first time in my life. And that wasn't scary for me. That was like, oh, Ed wanted that, right?
Yeah.
I'm not sure if you two could relate to this, but that's one of the most common things that I will hear is, I got my life back. I've had people come in tears saying, I had no idea what it was like to live without food noise. And I think that that just shows this is such a nuanced topic, not just a hot topic, because people are seeing this like, wow, I can focus on my job. And I wasn't already pre-planning my next 4 meals. And also, as you identified it, it triggered a relapse for you. And that's just such a juxtaposition in my brain, that I hope to see someday that we can see like what the research is showing here on how can we help use our own emotional skills or our therapeutic skills to achieve that same level of my food noise has ceased. And I hope someday we're able to mimic that.
If we can leave this podcast maybe with one giant idea in neon letters, is that eating disorders are a risk factor when it comes to GLP-1 medications. And I'm even hearing relief in your voice as you're talking about decreasing this food noise, but I'm also hearing the part of you that was relief, that was feeling relief was the eating disorder voice. And that's so powerful.
It's so powerful. It's so powerful. I remember saying to my doctor, I'm fine. I'm good. I could survive on, this many calories a day. I'm great. I'm good. Nothing's going to happen to me. And she's like, no, you're not, Jen. Sooner or later, it's going to catch up with you. But I had no insight into that whatsoever. So, and typically I know people say those medications that you can have the nausea, you can have reflux, you can have gastric upset or slowing down of the bowels. I didn't experience nausea. I didn't experience a bit of reflux, um, but I didn't really have any adverse side effects that would cause me to stop taking the medication.
Your initial
So,
experience on a GLP-1 reminds me of the honeymoon period in an eating disorder, when people initially are like, I can do this. I'm not experiencing any negative side effects. My life is thriving. And I think what you're identifying here is uh, that was kind of short-lived, and that then later, whether it wasn't a physiological side effect or not, the effect of the eating disorder worsening or returning came present. And I think Zoe makes a good point that people are reporting this decrease in food noise, but we also know that the ED is often quiet when it's winning, right? If the ED is getting what it wants, it doesn't need to yell very loud, right? And it makes me wonder how much of this GLP-1 is functioning to actually quiet food noise, or if it truly is kind of sedating the eating disorder because it likes it.
it's actually really Interesting question, because when my doctor and I, and we're probably going off the questions here a little bit, but when when my doctor decided, her and I decided, because she did intervene very quickly, like, and we got me some additional within, 2 or 3 weeks of starting the meds. She did get me some psychological intervention and started working on what was behind the eating disorder, like opening Pandora's box, I called it. Um, but the interesting thing about the eating disorder is my doctor and I both say the ED is going to ED, and coming off the GLP-1 is terrifying because it's a guardrail, right? And what I learned, probably the hard way, was that even if you're not on that medication anymore, by this point, your ED, he's loud. He's loud now. He's loud, and he's gonna you don't need that medication because his voice is so strong at this point. So,
Oh.
yeah.
So, given the fact that side effects of GLP-1s often mimic experiences of an eating disorder,
Mhm.
we see decreased intake, we see hair loss, bone density loss, all of these medical consequences and also mental health consequences, that preoccupation with weight loss and desire for control. How were you able to discern that Ed was back and it wasn't a side effect of the GLP-1?
Um, I think good question. I think when I started consuming considerably less calories and not enough to function on a day-to-day basis, and even though I was fine for a little while, it did catch up with me. And then people started making comments at work about my weight loss and what's wrong with you and you don't look well. And I thrived on those comments, right? Or Ed thrived on those comments. Um, and and I kept saying to my doctor, well, if I only lose 10 more pounds, right? 10 more pounds, 10 more pounds, 10 more pounds. The marker kept moving. And that's what Ed does, right? The eating disorder, it moves the marker all the time and it's never satisfied. So I think when my doctor and I kept I kept moving the goalpost, so to speak, she said, you have to arrive at a weight that you're comfortable with and that's healthy by design, not by accident or starvation. So that was part of the reason why I knew it was time to come off the GLP-1, because the weight kept coming off and it was getting to a point where we were considering inpatient treatment. And I'm an avid soccer player, and I was having a hard time on the field. I was really angry. I was not a respectful player, and just because I was under fueling. So yeah,
It took away the things that you loved.
it did. Yeah, it did. And I wasn't able to function at work anymore. And yeah, that and the weight was just coming off way too fast. Yeah. Did
I
that answer your
really
question?
Yeah, it did.
Okay.
It's so important to recognize when something turns concerning and you're sharing the experience is so helpful.
I really like what your doctor said about finding the weight that is more by design and not by starvation. And I think that's something that I see, even if we're just talking about eating disorder recovery, it is such a hard thing for people to accept. That, there's also the saying of like, a dream body isn't a dream body if it's a nightmare to achieve it. And I think
Mm.
that's kind of what this reminds me of. It's kind of like this starvation to achieve something doesn't sound like probably where your body wanted. But this just sounds
No.
like this was such a nuanced experience for you. And I am glad to hear they got you support quickly. I'm curious, do you feel like this caught you by surprise, the eating disorder relapse? Like, did you feel kind of like this should be an okay move? Or do you think from the beginning there was some concern of, is this going to trigger my history?
Absolutely not. It caught me completely by surprise. Completely by surprise. I know I had chatted with a few friends of mine who work in eating disorders at the hospital where I work, and I told them about this medication. They were like, hmm, is this something you sure you want to do? And I said, oh, yeah. not in a blink of an eye would I have thought that this would have triggered a relapse.
I think this is going to be very important as the GLP-1 medication is becoming more widespread, that it needs to be part of the informed consent process. That not only is having an eating disorder in your history a risk factor, but also it could create an eating disorder as a consequence of the drug. So I really hope that medical providers, when they're prescribing this drug, they're giving their clients an informed consent process that includes eating disorder as a potential risk factor, not just the side effects of an eating disorder that we're seeing them right, when in reality, it really looks like an eating disorder. It's no coincidence that the side effects of GLP-1s have similar consequences of an eating disorder.
Absolutely. Absolutely. I mean, even the fact, even if you don't have a history of disordered eating or an eating disorder, when you're on a GLP-1, and I've heard this from people who don't have eating disorder histories, just mechanically eating, like having to mechanically eat despite not being hungry, it's a chore. Like it's really hard to do. And I can see how easily someone who may have had some sort of body image issues could easily, like you said, it can potentially trip or cause an eating disorder or disordered eating symptoms. Um, and again, it's definitely an informed consent, and also having the resources available to pull in quickly rather than waiting and seeing how things go.
I think that's the biggest piece in the informed consent is not only is there a risk factor associated if there's an eating disorder history, but also we just don't know. And this is going to impact people differently. You know, having come across different people in my life that have taken GLP-1s, sometimes I hear some similar sentences, sometimes I hear some crazy differences. And I think there's it should almost be like in bold. We have no idea how this will interact specifically with your system. The other thing I think of is I have almost everybody that I work with in my ED practice fill out this form that I created, and it says things my eating disorder promised me. And at the top, it has little things like control, safety, weight loss, happiness, people worried about me, different things that they can select. And then
Mm,
on the back side, it says things my eating disorder actually gave me. And it has the same options at the top, and we see what it followed through on. And at the bottom, it's all negatives. So, hair loss, bone density loss, inability to see my weight loss, obsession with my weight, inability to be present with others. And it's a very good visual. And I almost feel like it would be useful for things my GLP-1 promised me and then things my
mm.
GLP-1 gave me.
Ooh, I like that. The
Yeah.
other key thing I think it's important to mention too is how quickly your muscle loss happens when taking these medications. Yes,
I've
bone
heard.
loss, but the muscle loss was very profound because I was a pretty muscular person. Like I had a good muscle mass, and how quickly that deteriorated was frightening.
I know
The
one of
muscle
your
mass.
passion oh, sorry. I know one of your passion areas is, like, women in their, like, older years and providing support for them, and osteoporosis is such a risk factor for so many women, and the combination between GLP-1s and osteoporosis and muscle mass and bone density loss is quite scary. I'm wondering if you can talk more on that.
Yeah. I mean, when you lose such a significant amount of weight in such a short period of time as I did, and not everybody's story is the same as mine, obviously, but I had lost, I think, 33% of my body weight in under 6 months, and or 7 months. Um, and when you're not eating enough food to fuel your body, um, although I didn't feel tired, I also wasn't meeting my protein goals, and I wasn't meeting my weightlifting, like lifting weights. I wasn't doing that because I'm still working my full-time career and, taking care of my family. And I didn't make time for that, even though my doctor, emphasized you need to lift weights, Jen. Um, and I don't know that women and men know that it's so important when you're taking this medication because of it, the loss happens so quickly, both of bone mass or bone density and of muscle mass. And then, like you said, you're at the risk of osteoporosis, or even worse, I think it's called sarcopenia, those sorts of things. And I did lose muscle, our bone mass, our bone density, and that's a hard thing to reverse once it's been done, right? So I think women in middle age, we're already fragile. We're already at risk of these things with menopause and perimenopause and the bone loss. Adding a GLP-1 and not being able to follow through on everything you're supposed to do on the medication definitely puts you at an increased risk of the osteoporosis.
Again, I just want to thank you for sharing your honesty of this lived experience here of what you've gone through. And I do want to further ask a question. You experienced a decent amount of side effects, like very significant and health impacting. I'm curious, are there still things that you are waiting to resolve, or what did that kind of recovery from this look like for you?
Um, Recovery looked, initially it was me saying, okay, yeah, I need a care team, right? I need more than just my doctors. So we pulled in an ED focused dietitian. We pulled in an IFS therapist, and we also pulled in a naturopath who works with my doctor. That was my care team, who I saw weekly until I was able to get into an IOP program at Toronto General Hospital, which is a pretty intensive. I think it's a 10-week program. Um, so recovery has been long. But it's also been something that I didn't do when I was a teenager. I didn't have proper eating disorder support and recovery when I was in hospital. So this time around, it's something that I'm doing because I need to have a good relationship with my body and I need to respect it and have appreciation for what it can do. Um, Effects from it, I would say I've been pretty lucky. Um, I've been able to build some muscle mass back on again. My bone density is staying stable. Some low blood pressure issues, but they're resolving. Yeah, I'd have to say my body's been pretty kind to me. I've been pretty lucky in terms of isn't any sort of long-term effects that I know of.
Well, you're using the term lucky. I'm hearing that you took a lot of intention and care and focus. You took some very needed steps, and I think that's huge that there's a pillar of hope for people if they are experiencing this, but that you didn't just happen upon this recovery. You sought out the resources you needed, you accepted that help. And so I hear you say luck. I think you worked for this.
Well, thank you. Thank you. There was certainly bumps and there were certainly days when I wanted to tell everybody to go jump in the lake. Um, um, and Having an eating disorder in midlife or having a relapse of an eating disorder in midlife is very different than when you are a teenager, right? Your wisdom and your insight and your lived experience is much different. When you're 18, I think your window is smaller, and I don't mean that in a negative way, but as a 50-something-year-old woman, I have daughters, right? I have a career, I have friends, I have family, and I have my toolbox of things that I've accumulated in terms of mental health over the years.
Oh, I was going to ask you that exact question. How was recovery different the first time and the second time during midlife? And uh, the main thing I took away is your world was bigger, and Ed really shrinks your world, and you were able to recognize all of these things that were so special to you. Oh, I could choke up just talking about that. I guess if we're going back in time,
Yeah.
was there anything that your care team could have done to prevent a relapse when you were prescribed a GLP-1?
I struggled with that one for a while, and I don't think there was anything that could have been done. I think, as I said, I was one of my doctor's first patients in her program, and the research behind the GLP-1s and their side effects they weren't well known, especially around eating disorders. So no, and I think a relapse needed to happen almost because once it happened, we were able to open Pandora's box and find out, okay, why is this coming up again? And how, let's get to the root of this and deal with your trauma and be able to, I'm not going to use the word fix your eating disorder, but to give you the skills and the tools and the knowledge that you didn't get the first time around. Yeah.
What a way of writing your own story, of being able to reframe this for something that, like, you're almost feeling gratitude that it happened. Um, I think that's awesome and very beautiful. I also think we're, talking about these side effects, but I almost think people are kind of numb to side effects. I mean, if you get almost any medication, flip over that page, it's like lists. And I think to an extent, I mean, I don't know about you, maybe people do this, but sometimes if I get something like that, like I was just sick, so doctor prescribed me something, right? I didn't look through all of them. I think he listed maybe two to look out for, but I'm also just kind of even worried, even if they start to write that on there, that we need to have a more intentional way of saying, like, this is significantly life impacting. Because I don't even know if people would see it, or if they do, there's certain side effects. I'm like, oh, I don't think that would happen. What is that, the 1%? That I almost think
Right.
we need a more eloquent way of highlighting this is of high concern, and these are the red flags to look for. I think that would be the next step I'd like to see. If this or this occurs, call your doctor immediately. And I think they do that with the physiological symptoms, but I don't know that I hear it as much about the psychological symptoms.
How true. How true. And sometimes people are prescribed these medications, and whether they order them online or um, wherever they get them from, and there's not that proper follow-up, right? And sometimes I think people are afraid to share the mental health um, side effects that are happening. Um, Maybe more so than they would be with with the physiological side effects. Um, because, like I said earlier, if you have any sort of inkling or any sort of twinge in your head that has disordered eating, or it's a little bit like a lifeboat that you're grabbing onto, and like, this is cool. This is cool. But um, yeah, I think a lot more education and awareness needs to be brought to the table when doctors are prescribing this medication for sure.
You bring up such an important point about accessibility of these drugs. You can order it online. So I often reflect on an experience I had. I was parking my car and I was using like a park mobile app. I can't remember specifically which app it was. And after I checked out, it was like, oh, you won a prize of a discount to a GLP-1 in my parking app. So not
Oh,
only is it so accessible, but it's everywhere. And people who are vulnerable to eating disorders to begin with are just inundated with advertisements and conversations around it. And hearing that it's this miracle drug, and no one is talking about experiences like yours, where it really significantly impacted the quality of your life. So I'm just, Maria and I have said this so many times today. We are so grateful for your story. And especially in midlife, I
Mm,
think I've heard that midlife is called those invisible years. And here we are giving
yeah,
people a drug to shrink themselves. Talk about becoming
right.
invisible. So I would love to hear more about how you would want to support women in these midlife years who are experiencing body image and eating concerns. What do you want them to know?
I don't know if it's just me personally, but when it comes to body image and eating disorders, we think a lot about young people, right? We think of young people as having men and women, boys and girls having eating disorders. And um, it, I was speaking at another thing a couple weeks ago, and women were saying that we're in midlife. We feel we can't talk about it because we feel we should have a handle on it by now. Right? And we've got other things to worry about. Like, we've got our own children, our grandchildren. Oh, it's just a midlife crisis you're going through. Um, and when I was speaking with these women, there are so many of them that have carried disordered eating and eating disorders through their lives. And then in midlife, your body changes again, right? So you're forced to, you're facing all these other changes in your body. Um, But I think women in middle age don't feel they can talk about it. And there's a lot of shame behind it. And perhaps oh, why do you think about your body so much? You're so vain. Like it's focus on something else. No, no. I feel women, I want women to know that they're not alone. They are not alone. Um, and there's no shame in talking about it. Um, I'll just reference this last talk I did one last time. There was 65 women on the call, and 35 women raised their hands at the end of the call because they all had questions and said, "Me too. I get this. Yes, me too." 35 women were able to say, "Thank you for breaking that stigma and allowing us to have a voice and taking that shame away." I want women to know that they can be vulnerable with someone that they trust to talk about it because they deserve it. It doesn't matter how old they are, um, because it's a life stealer. It can be a life stealer, and it's okay to talk about it, and there's no shame.
It makes me wonder, obviously over 30 stayed. I wonder if there were some that considered it or some that didn't feel like they were ready yet to speak up or to kind of out themselves in that way. But I think that's just a very like high magnitude number and percentage. You bring up the pressures and almost, I would say, like the stigma and blame that comes with an eating disorder in mid to late life. Because, yes, I've had people come in here and they're like, I guess I'm just like a bad mom. Like, I should be focused on my kids' academics. And instead, I'm worried about my body. And I'm like, this is a diagnosable disorder. This is not choices, right? That's the whole idea is that it pulls from your values. But I think absolutely people, we've talked about this in another podcast before about how people almost feel like they should have grown out of this by now or feel like this is like a kid thing. And it's like, no, this is absolutely valid at any point. And I think something else that is just not discussed enough is the natural body changes that women are going to go through throughout life. We do not just stop growing at the age of 18 and then all of us 18-year-olds look like that at 50. Our bodies progress and change. And I think if there was less stigma and more acceptance and even just preparation of those changes, we're talking, perimenopausal, postmenopausal changes. When we grew up, we learned about our development in puberty, but I don't recall somebody saying, oh, and when you're 52, this could happen. I think that
No,
people happen upon these body changes, perceive them as bad, perceive them as need to be changed, and then get blamed for wanting to change them.
I
Yeah.
think you just nailed it on the head.
I was just
Just nailed
thinking
it on the
about,
head.
oh,
Yeah,
yeah, I was just
yeah.
thinking about that where we talk about puberty, all of the changes that happen in puberty. We also talk about all the changes that happen in pregnancy for women, but no one talks about menopausal states and how that impacts your identity, the way you interact with your body, your hormones, your sex life, your relationship to your body. And it makes so much sense based on what you said of you should have it together by now. And there's so much shame related to that.
And with this shame combined with easy accessibility, I find that to be a very dangerous trap. And Zoe brought up the ad on like a parking thing. Like, what are we doing here? But I also I can't think of another drug that impacts so many physiological systems that you can technically get just online without a technical doctor following you. And then you get to change your own dosing. I can't think of almost anything else like that. If you think about it, if somebody's on a psychiatric med, their psychiatrist is going to assess and then recommend changes. Individuals have access to change their own dosing. And it's just the only med that I can think of where that's just completely unmonitored. And people are like, basically do what you'd like.
Mm,
A- Aside from dosing, birth control came to mind.
Yes, but I think that's the dosing part to me is scary because I
Mm.
think too, if you have that pathology of an eating disorders are always moving a goalpost, right? And so it worries me. And I guess something that I've seen around is that people start upping, and they get to the spot. Then now that they're up here, they're like, I can barely swallow. I have this nausea. And then nobody's even helping them come down. So even if somebody's coming off of a med, somebody's going to recommend, here's the way to titrate down. People are like asking me, what should I do? And I have to say, I have no idea, and I'm not allowed to give you a recommendation on it. But even if I knew, couldn't give it, but I don't know.
exactly, exactly. It's and the fact that I mean, I think you have to be 18 to be able to access these drugs, but people that have or active eating disorders can get them, like by, I think, by mail order, or and also people with eating disorders can be very sneaky. I've one of them. You can pull the wool over your physician's eyes, right? If you're not properly screened, right? Or they're not really thoroughly assessed before giving one of those medications.
I don't
I've
want to speak. Oh, go ahead. I don't want to speak out of turn here in case I'm wrong, and so I want to give the disclaimer there. But Zoe brought up like birth control, and then we're talking about
Mm.
GLP-1s as the two that are like the most like unregulated. Part of that can be good for accessibility, but it does make me wonder if aspects of women's health are not being taken as seriously and feeling like, oh, a doctor should like probably monitor all medications.
That came through my mind as well. Yeah.
And if I'm wrong, this is just a discussion, but it does make
Yeah,
me kind of curious that it's just kind of like, oh, women have an issue with their body. Well, they can get it and handle it. Oh, women would like access to birth control. They can get it and handle it. And
yeah,
even things like birth control. Let's talk through those side effects. Um,
right.
Right. Like
Yeah,
we give these women birth control for their PCOS rather than giving them behavioral interventions to support the quality of their life. Or and similar with these GLP-1s, like what would happen if we gave them the support and adequate care that they needed instead of just slapping a band-aid on it? And not saying that birth control is not life-saving, and not saying that GLP-1s for some folks is also not life-saving, but I don't think we're doing, as you've shared, a thorough enough assessment on how are these people actually interacting with these drugs? What is their intention? What are their fears? What are they hoping from it? And it's really sad, and it's causing these consequences.
it would also be helpful in the ideal world when someone is going on a GLP-1 medication, regardless if they have a disordered eating or eating disorder past, to have a dietitian or a nutritionist or someone attached to that who can see the signs, who can help you with that whole mechanical eating and getting enough protein and um, all the other essentials. Um, because that piece I think is overlooked, unless you're working in unless you're working with a team of practitioners. But I almost think you almost need someone that can focus on the food piece as well, to identify any red flags, to help you get your proper intakes in, and really work through that mechanical eating. Yeah, it was just a thought that came into my head. Yeah.
Integrative care, so needed.
Thank you. Integrative care. Yes.
I love doing these podcasts because Zoe and I will like nod to like each answer, like us and the guest will say, because I'm sitting here like for an eating disorder, something that we drive home is you need a multidisciplinary team because these are multidisciplinary disorders. I wish that that same gusto was used for GLP-1 management of maybe we need a multidisciplinary team that's all collaborating, communicating, all assessing because different people are even going to see different things, right? So in my eating disorder work, I might pick up on a behavior that I'll share with a dietitian. They might pick up on something different. So even the amount of eyes pulling from another scope, to me it just shows the intention that we want we want you to be healthy and well. We don't just want you to lose weight. We want you to be well. And that's what it would almost kind of sound like to me, is like this wellness team. And it sounds like you created one when you chose to come off of this and engage with recovery. But
Hmm.
man, it makes me wonder if it was almost like a requirement as it is for us. I wish that that was kind of driven home. You're going to prescribe one. Let's also give 3 referrals at the same time.
It's I'm stuck on this woman issue because I'm a very big feminist, and this stuff, women's issues, is a huge passion area of mine. You can get a GLP-1 rather easily. You have to go through so many loops to get your tubes tied. So what are we telling women? That we have to make it so hard for you not to have kids because that's your role in society. But don't worry, it's really easy for you to become thinner. And this is what we value in women: to have kids and to be smaller. And like that, I'm angry. And thinking about this from like a medical point of view, and then now like a macro system point of view of how this assessment is likely a product of what we believe women should look like.
Oh,
That's my TED Talk.
I can't wait for you to post that clip of what are women's roles to have babies and be thinner. Yeah, this is like a systemic problem here. This is not just like the GLP-1, honestly, is not the problem. It sounds like it was created for a very good reason. But then society has almost weaponized it. And again, even with kind of going back to what you mentioned about like BMI initially, that BMI has not been rescaled in so long. BMI doesn't take into account so many things. And actually, the risk factors associated with being slightly underweight are so much higher than being slightly overweight. Yet when
Hmm.
people are underweight, they're like, oh my gosh, you are doing great. You get a gold star from your physician. But the second that goes into the obese range, which typically, honestly, in my practice and kind of even like in life, I can see people fall into that and their body's the healthiest that it has been. So I think also too, even just like billing codes on things like that. It's like once somebody's diagnosed that, it's like, oh, we must engage with weight loss interventions. And I'm always curious, like, did the patient ask that? Or did you say, I see your BMI, whether you care or not, we will offer you a GLP-1?
Yes, yes, absolutely, absolutely. Um, yeah, I mean, BMI is a whole trigger in itself for a lot of women, right? Like you said, some women can have a high BMI, but that doesn't take into account their bone structure and their muscle mass and all those sorts of things. So let's not jump from your BMI to you needing a weight loss medication. Yeah,
Well, we
yeah.
could
I
talk
think the
about this.
GLP-1s are so glamorized as well, and that's the attraction,
Oh my
right?
gosh, yeah. People saying on TikTok that they want GLP allegations, that they want to have a GLP summer. You're romanticizing it is such a perfect way to describe it. But we could talk about this all day. We do have to wrap up because we're
Yeah.
almost at our hour point. I want to name one thing that people have reported suicidal ideation as a result of GLP-1s, and they're having these very, very potentially lethal consequences of it with minimal support. So
Mhm.
the fact that we are talking about it, it needs to be an integrative care team is so important. But our last question is, what has healing looked like from this?
Oh gosh. Healing, healing's looked very different this time around. Healing has looked at, for me, realizing that I am in midlife and my body's not as resilient and it's not going to necessarily bounce back as quickly as it did when I was in my teens. So appreciating for where my body's at and understanding that, um, you know, this time around, I need to get it right. Like I need to take care of my body because it's getting older. Healing has looked like a raw dress down for me of, what contributed to my eating disorder. My past traumas, my histories, my early childhood experiences. Actually looking at those with my amazing therapist, looking at those with her and understanding why I developed an eating disorder and having an appreciation for all parts of myself, even the ED portion of myself. I think a big piece for me was healing has also looked at separating Ed and realizing that Ed is not my entirety. He's a piece of me. He's not my entirety, and that he doesn't get to sit at my table very often anymore. So healing has looked like as I said, really diving deep into why the eating disorder developed, um, and also learning to love myself again and appreciate my body for what it can do, and externalizing the eating disorder was huge for me, which my dietitian helped me identify. Without my team, I don't think I would have got to where I am today.
I tell my clients that Ed is on their shoulder and we're just gonna flick him off the shoulder.
Yeah, it's like a little gazoo that you want to get rid
So,
of. Yeah.
any last comments before we finish up?
Just what I said earlier, I think, in terms of, for the women out there that are considering a GLP-1 or have disordered eating and eating disorders in midlife, that again, it's okay to talk about it. It's not selfish. It's not vain. It's not, it is a diagnosable mental illness, and it's okay to talk about and get help. And through getting help, it's only going to help you have a better appreciation for your body and to be able to lead your most successful and happy life. So I think the biggest thing for me is don't be ashamed and be vulnerable and ask for help.
One final thing that I just want our listeners to hear. If you are on a GLP-1, we are giving you no judgment. There is no shame there. I think in the ED world, we can have this feeling of almost people are like embarrassed to share these things. And if that is you, I want you to know that like your story is entirely valid. Your efforts are valid. This podcast episode was just an attempt to highlight the nuances and the risk factors that aren't being talked about and kind of pulling away from the glamorization. But we do want you to know that if you are on a GLP-1, we are sending, our support to you. Um, we see you as well. So I did want to make sure that that message was heard as well.
Yeah, absolutely. Just to be talking about these things with your medical and your mental health team. Well, I will give one last shout out to our advertisers, Alsana. Alsana has eating disorder treatment centers in both Alabama and California. They have virtual options as well. And wherever you are, whoever you are, take a seat with us. Thank you.